Yo, yo, yo. Hey guys, welcome back to another awesome edition of the Best Practices Show podcast. It is Friday. Happy Friday, everybody. And I have a special episode for you today. We talk a lot about team members and their roles and how they impact the practice. But one team member we don't really talk about a lot as an industry as a whole are the dental assistants. I have a special place in my heart for these amazing people. And we often don't talk about how to maximize the value of a great dental assistant, what it means to you, what it means to the practice, and what it means to the assistant themselves. So today, I have an amazing coach on. Her name is Renae Graeff, and we talk about how you, as a dentist, can maximize the value of your dental assistant. So please listen up. I hope you guys enjoy this, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. The jam around here is to create some great podcasts for you so that you can create a better practice and a better life. And a big part of that is maximizing the value of each one of your team members and giving them the chance to become more valuable. And today we're going to be talking about your dental assistant. Now, I have a special place in my heart for dental assistants because there's a lot of education out there, usually for the admin team and for hygiene. And there's some for dental assistants, but they are the ones that make it happen in the operatories. And I have one amazing coach today. Her name is Renae Graeff, and we're going to be talking about how do we maximize the value of your dental assistant. Renae, thanks for being back. I always appreciate you.
Thanks for having me, Kirk.
Yeah. Now, this is a pretty cool thing because not only are you an amazing coach here, but you also have an amazing career as a dental assistant. So you're very qualified to talk about how do we maximize the value of an assistant. But let's start here first. Like, why is this important? Why is this subject so important?
Yeah, many dental practices are missing a huge opportunity by underutilizing their dental assistants. When assistants are empowered to work at the full extent of their training and state regulations, the entire practice benefits.
Yeah, I totally agree. Now go back to the efficiency thing because, you know, everybody's trying to find a more efficient way to work. Like how do we do this? Give us some good perspective on increased efficiency and profitability.
Yeah, proper delegation allows the doctor to focus on high value procedures while the assistants handle essential tasks independently without the doctor's supervision. And with a well-utilized team, a practice can see more patients per day without adding hours of stress, limiting bottlenecks where you're spending time doing tasks that your assistants could handle, ultimately slowing down your production and overloading your schedule.
Yeah, absolutely. Everybody's coming to the conclusion that bigger is not always better in dental practices. And if you utilize each one of your team members in a better way, that they become more valuable, and utilize the operatories in a more valuable way. Now you can see why we don't have to add more ops and more patients and make this crazy. And if you do so, I think what you're also going to find is you're going to keep dental assistants a lot longer. Like everybody's trying to find a better way to improve retention and even make your team members feel better with a little bit better team morale. Don't you think, Renae?
Absolutely. Assistants who may feel unclear on expectations or are overlooked can lead to frustration or even turnover. When you have an amazing assistant, they really are your right hand. We are masters at multitasking, ensuring patients are comfortable and relaxed, helping them to understand the why behind any treatment recommendations, pretty much being your clone in a way, to reiterate necessary goals to getting that patient health.
Yeah. Well, first thing, you would never want me to be, you'd never want a clone of me. And then if you're listening to this and you heard what Renae says, like multitasking, some of you think you're great at it, but you're really not. You miss steps all the time. That's where a great dental assistant can make you look like a rock star, right?
Absolutely.
Yeah. Now, the ultimate question is, dentists don't do this. Why don't they fully utilize the dental assistants that they have, the amazing dental assistants that they have in their practices?
I would say, the I can do it faster myself mindset. There is a mentality that taking the time to teach takes too long, when in reality, investing a little time now saves hours each week in the long run.
Yeah. So you think about anything, like photography is one of my favorite examples because you think you can do it. You go to a great course, you get this amazing camera, and you don't let anybody touch it. And what you do is you paint yourself into a corner. Meanwhile, you have an amazing team member right there who could do it better than you, do it with all of the patients, not just some of them, take all of the photos, not some of them, and actually put the photos where they're supposed to be. When you change your mindset from I'm the only one that can do this to no, someone else can do this better, like an amazing dental assistant, you're freeing up thousands and thousands of hours. So why else don't dentists do this?
Not wanting to give up control. I think that might be the top reason.
What? Like, are you implying that people are control freaks?
A lot of dentists, yes. Some dentists feel more comfortable doing everything themselves. They feel they have more control over the experience or the outcome. But ultimately, holding on to low-value tasks really prevent the doctor from focusing on higher-value work. In my experience, the doctor can actually have more control over doing the dentistry they really want by allowing their assistants to handle these lower-value appointments. When you have a great assistant as your right hand, you need to relinquish control and properly train them to your standards so you know these appointments will be handled the same way you would. This will free up your time to do the dentistry you really want to do, and the patient experience can even be better this way. Oftentimes, patients connect more with the assistant than the doctor.
Amen. There was a lot in there. That's so true. It's counterintuitive. Like, you can actually have more control. I love how you said that too, because now you're not feeding your control addiction. You're actually having more control, but you're doing less. So that's really, really powerful. And I totally agree. Even when I go to the dentist, I love my dentist, but I'm going to be talking to the assistant way more than I'm going to be talking to the dentist because I want them focusing on what they should be focusing on. So this becomes an awesome opportunity for both of you to grow. And when you let go, you actually have to, let me say this. How do I say this? In order to grow, you have to let go. You can't take on more. And so seeing this correctly. Now, a big part of letting go is the legal thing. Like some people, and I would say a lot of dentists that I've met, there's this fuzziness around awareness of what's legal and not legal. Can you talk about that?
Yes. So some dentists don't know the full scope of what their assistants can legally do in their state. So do some research for your state and find out more times than not, your assistants want to do more than they currently are. As a coach, I've had countless conversations with assistants all over the country opening up to me about the fact that they are not able to perform the certain tasks they know they can legally do.
Yeah, totally. And in some states, actually most states, I actually don't know how many states now, there's 40 some states that allow others to administer anesthesia. And sometimes you get into this pigeonhole of like, I'm the only person that can do this. What an amazing opportunity to grow the practice and grow the team member in that respect. So, and we don't talk about this enough, but like what you're talking about, Renae, is like, this is where you turn from being a boss to a great coach. The real opportunity is you get to grow human beings, to do more, to be more confident, to not just be a dental assistant. They actually become, I love the term restorative partner. Those are always great things that I see in this community. But you have to, a big part of this too is you have to have systems in place, right?
Absolutely. If assistants aren't properly trained, doctors can't trust them to take on more responsibility. So having clearly defined systems and onboarding procedures is definitely key. Yeah.
So let's go a little bit deeper. Like, let's go into the true value of a dental assistant. They're not just support staff, or God forbid you use some of the terms that people use around dental assistants, like they just turn over rooms, they just suck. I've heard dental assistants, now I'm using other people's words, suck spit. I actually had a dental assistant say, I'm like, you don't do that. No, there's way more than that. So I think you gotta be careful about guarding the language. Like we gotta talk positively and think positively. All roles are important. And the biggest part is the language and the thinking around the role, because a great dental assistant can be a key contributor to the practice. But what can dental assistants truly do without the dentist?
Sure. So some pre and post-op responsibilities would be medical history updates, patient education, and post-op instructions. Photography, as you mentioned, is a big one. Clinical responsibilities would be packing cord, placing and removing rubber dams, radiographs, impressions or scans for study models, crowns, guards, trays, fabricating and cementing temporary crowns, whitening procedures. And if you have an expanded functions dental assistant, this varies by state, but in general, they can place direct composite and amalgam restorations, freeing you up. Do bite adjustments. They can help the hygiene department with coronal polishing, preventative measures such as sealants and fluoride, limited orthodontic procedures, and removing sutures are just a few of the things that assistants can help with without the doctor.
Yeah. Now, if you're a dentist listening, go back to the list. Think about that list that Renae just shared and ask yourself, do I like those procedures or do I loathe them? And I'll challenge you that you don't really like any of them. You would be thrilled for somebody else to do them. And if you have the right heart and the right mindset, you'd actually be thrilled teaching somebody else to do them so that you can focus on the things that matter. The true art of somebody who becomes more productive in less time is they don't do more. They actually focus on less and the things that they do well. And this is where you can partner with a great dental assistant. So maybe dig a little bit more deep into like the efficiency responsibilities. What else would you add, Renae?
Yeah, so sterilization and operatory maintenance, ordering and inventory control, which is a huge one, assisting the admin team with schedule maintenance.
Yeah, I think that's a big one too. Every day, just go through the schedule, even if it's for 5 minutes, what worked, what didn't work. You can't spend enough time thinking, how do we do this better in our schedule? That becomes a key piece to your happiness in the future. So, and if I'm a dentist listening, how do I fully, give me some steps here. How do I fully utilize my dental assistant?
So oftentimes we are the only team members you have that can wear most of the hats in the office. We can help with admin duties, as we said, treatment planning and acceptance, hygiene support with preventative procedures, being your right hand with all your restorative procedures. And FDAs specifically can often boost production and value without you having to hire an associate. So some steps would be learn your legislation. As a leader, you need to know what your state is going to allow so that you can fully maximize the role of your dental assistant. Another one would be the 2-op model or dovetail scheduling. So this allows for more patients in the same time. The dental assistant is sharing care through delegation of non-doctor tasks. And lastly, develop your dental assistant. We can't stress this enough to take the time to create specific and impactful onboarding for them and stick with the systems. Remember that systems drive the practice. So you need to develop your team to drive the systems.
Yeah. Now go back to dovetail scheduling. You have helped me understand, we've heard the term, and actually I'm not an expert on this at all. What is dovetail scheduling? How would you describe that?
So it's basically the assistant would have a column and the doctor would have a column. So any of these non-doctor tasks can be placed in the assistant's column. And in turn, this is freeing up the doctor's schedule to see more patients. And it's called dovetail, I believe, because if you know anything about carpentry, the dovetail cut of a piece of wood kind of fits perfectly into another piece.
Oh,
so
I didn't even know
that's where the term came from.
I had no idea. Yeah. It sounds cool. So that would make sense that it came from something like that. I love it. I love it. Well, give us some final thoughts, final takeaways. If I'm listening to this, what do you want me to do as a dentist to better think about how do I maximize the value of a dental assistant?
Number one, review your current onboarding plan. So is it a process or just a hope?
Yeah.
Here at ACT, we coach the 333 onboarding plan. This is a helpful way for the team member to learn information they should know after 3 days, 3 weeks, and 3 months. So this allows the assistant time to properly layer on the learning without waterboarding them. The second would be schedule one-on-one check-ins to connect and engage with your dental assistant. The check-in is super important. This allows the team member safe space and time to ask for your support on duties they feel comfortable with. You want to audit your daily workflow. So what tasks are you doing that an assistant could own? And lastly, ask your assistant, what's one thing you wish you could do more of in your role? I guarantee you there will be some tasks that they come up with.
Yeah, great question to ask in a regular check-in. What's one thing between the last time we chatted and, looking at the next couple of weeks that you would like to do more of or learn more of? You'll be surprised by how many people, when you get into a regular pattern of asking that question, will actually give you a great answer, and you can help facilitate that. That was so great, Renae. I believe so strongly in what you've said. And if you're a dentist listening, you get this right. You're going to make, again, your life better, the practice better, and the team members' life better. So we have a bunch of resources back here, and that's what this is all about, the Best Practices Association. And if you join the BPA, you can join for free. But if you go into premium, you're going to see we have all of the supportive resources for this. Renae mentioned the 333 onboarding tool. It's one of the most valuable tools you can implement in your practice. You can use that for your dental assistants, in which they know what to do by 3 days, 3 weeks, 3 months, and it creates a regular process. You can improve the process over time. If you want to learn more about check-ins, you can see we actually have an agenda back there that you can use on a regular basis. And then when we talk about scheduling and Dovetail scheduling, you can use our ideal day scheduling guide. It tells you how to do this and build a schedule that actually works for you. And if you need more help with your practice, you can always reach out to one of us. We're a helpful organization, and we have Renae on our team. And we also have Courtney on our team, and we'll help you every step of the way. Helping your team members see a bigger future, helping you see a bigger future, and maximizing the value of a dental assistant will change your life and change the practice. So I hope you guys enjoyed today. I can't thank you enough for listening. Keep showing up, and we're going to keep bringing it. So until we see you guys next time, or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.